All right. We might make a start while some people are still joining. So thank you everyone for attending today's ISBNPA webinar titled Food Insecurity Among Children and Families. So the webinar today is presented by the Special Interest Group, Children and Families, and we have two amazing speakers who I will introduce shortly. The plan is to have around 15 to 20 minutes for each of our speakers to give their presentations, and then we'll have a 15 to 20 minute Q&A at the end, and then we will close off the webinar. So before we get into it, I'm just going to give a really brief introduction to the webinar, just covering some general housekeeping before we move on to our speakers. So as part of ISBNPA, as many of you will know, these webinars are organised as an extra service for our members, and they're organised by the special interest groups of ISBNPA. You can see a full list of the special interest groups and how to join them on the ISBNPA website, and the link to access that information is there on the screen as well. On the ISBNPA website, you'll also find information on any upcoming webinars and also be able to access recordings of the past webinars. I will say that today's webinar is being recorded, and the recording will be uploaded and sent out over the next couple of days. So just be aware that if you miss anything, you will be able to catch up on it. So I thought I would just give you a brief overview of the Children and Families Special Interest Group for those of you who don't know. So the Children and Families SIG aims to build a community of ISBNPA members who share an interest in conducting research with children and families around nutrition behaviours, physical activity, sedentary behaviours and sleep. Our co-chairs are the fabulous Alissa and Taniya, who unfortunately were not able to join us today, which is why you have me moderating this session. So we're in Zoom today. Everyone but the speakers and organisers are automatically muted to help prevent noise and distractions during the presentations, but we do really want this to be an interactive session as much as possible. So please send through your questions in the Q&A chat section at any time during the presentation, and we'll have our Q&A time at the end where we will triage these questions and open up to the floor as well. So really looking forward to having an engaging session, and we've got some wonderful speakers, and I'm sure that their presentations are going to lead to lots of interesting questions. So without further ado, I will introduce our two wonderful speakers. So we're going to start off with Christina Vogel. So Christina is Deputy Director at the Centre for Food Policy at City University of London. She's a registered nutritionist and has worked in public health nutrition for around 20 years in Australia and Europe. Christina's research aims to inform the implementation and evaluation of food-related policies and interventions which optimise population nutrition, reduce inequalities and protect our planet. She leads a program of research dedicated to improving population health and reducing inequalities through food policy and nutrition-based initiatives. And then following Christina's presentation, we will have Dr. Rebecca Lindberg, who is a public health nutrition researcher and Dean's Postdoctoral Research Fellow at the Institute for Physical Activity and Nutrition, also known as IPAN, at Deakin University. She has over 10 years experience in food security policy, practice and research, and has worked in both academic and not-for-profit settings. Currently, she's leading a Cochrane systematic review of social and economic policy interventions to assess their impact on household food security, and she is in the final stages of a funded study in collaboration with the Gretchen Swanston Centre for Nutrition in the United States on young families and food security. So I'm going to stop sharing my screen and hand over to Christina. Oh, you're still on mute, Christina.
That's not helpful. Thank you very much, Georgia. Right, can you see my screen okay? Excellent.
Yes, perfect.
Well, thank you all for joining this evening or this morning or this afternoon, depending on where you're dialing in from. I'm really delighted to have been invited to present today to share some of our findings. And this work really comes from the team at the Centre for Food Policy, and it really builds upon several years of work from our lived experience research, where we really try to find authentic reasons and authentic experiences for people and across the food system. And this particularly, this evening, we're focusing on why poverty leads to poor diet. So it's a fairly quick presentation tonight, and I'm going to start with a little bit of scene setting about the UK. So why is this important? Well, in the UK, life expectancy, there's a huge gap in life expectancy between adults living in those more affluent areas and more deprived areas. And this is really very stark, as you can see here, and quite unjust. And the difference in life expectancy between adults living in the most deprived and the least deprived areas in England is about 8 years, which is quite a considerable amount of time. And a key contributor to this inequality really is diet-related conditions. So people living on low incomes, they suffer more diet-related diseases than those living on higher incomes, and these are preventable. So really much more needs to be done to address poor diet in the UK and the underlying causes of that around low income and food poverty. You can see here that there's a range of conditions which show stark inequalities. And in particular, I wanted to highlight this one, preventable chronic heart disease. There's a real difference of twice. So those individuals or adults living in the most deprived areas are twice as likely to suffer from preventable heart disease than adults living in the least deprived neighbourhoods. And here around dental decay, that children are living in the most deprived areas are 3 times more likely to have tooth decay by the age of 5. And a key question really is about how can we avert these outcomes and what needs to be done. And really to be able to understand that, we need to be able to understand that through lived experience research, to understand the context in which people are living. But this is a particular concern because current obesity rates in childhood show that there's actually increasing inequality. So you can see here over more than a 10-year period, there's a huge increase in inequalities in childhood obesity, which means that there's an increasing inequalities in poor diet as well. And you can see here there was a particular peak around the COVID period, and it did start to resettle. But during the current cost of living crisis, there's concerns that this could be exacerbated and increase again. And I just wanted to show this slide to you, which is around families experiencing food insecurity in the UK. And again, that we've seen quite a peak. Since the cost of living crisis, it really has peaked and it's still maintained these high levels. And there's a huge difference in food insecurity levels among families who have children and those without children. Excuse the N that's missing from this graph here. But this work comes from a food insecurity tracker from the Food Foundation in the UK. And it really does show that families who have children are more likely to experience food insecurity. And this is a real worry, particularly when rates are around a quarter of families in the UK. So really, we need to better understand the context of families' everyday lives to ensure that we can develop food policies that better support families and can start to address those inequalities in diet and health and life expectancy. So our lived experience research has really focused on very in-depth interviews and ethnographic work with families living on low income and experiencing food insecurity. And as part of this work, we've uncovered 5 key pathways that really show and highlight why less healthy food choices are the obvious and most sensible choice for many families living on low income. So I've just highlighted here those 5 key pathways, and I'm going to describe them each in turn with a little bit of illustration through quotes from families that we've been speaking to. So the 5 key pathways that really indicate that poverty or low income lead to a poor diet, the first one being high food and energy prices. And the energy prices has been particularly the case during the recent cost of living crisis. And there's real concern about increasing energy prices again over the winter period here in the UK. The second pathway is around poor quality housing and poor quality cooking facilities. The third is around time and cognitive pressures that just make it very challenging for low-income families to follow a healthy diet. The fourth is that really unhealthy foods have a role in meeting social and emotional needs for many families. And then the fifth area is really the availability and appeal created by the very unhealthy food environments that are just ubiquitous for many families. So I'm going to talk through each of these in turn. So the first one is really having to manage tight budgets amidst rising food and energy prices. And really this means relying on cheap, highly processed foods that use less energy and cost less than cooking from scratch. So really one mum said, that we have to rely on cheap ready meals a lot. I'm having to buy the fattiest stuff. I very rarely buy a lot of vegetables because I just can't afford it. We end up buying like ready meals and things like that. My son, for example, this week, he's had a lot of pizza, and he's had a ready meal lasagna. I'm not cooking from scratch for him. And basically she's saying that she's feeling really depressed by this because she's got so little money in the bank, and these choices are the obvious choices. Also, that unhealthy food goes much further than healthy foods. So one mum said, my child loves watermelon, but they're just so expensive. They're all $3 and it's all gone in one go. And I think that's one item for £3, whereas I can buy 4 packets of biscuits and 10 packets of crisps for £1. So really families are moving away from perishable foods like vegetables towards those that have much longer shelf life and are also much more appealing to their children and won't be wasted. Food waste is a real concern for many families living on low income. And I just wanted to illustrate that this sense that families experience has also been exemplified through quantitative research and tracking of food prices in the UK. So here again, this is work from the Food Foundation and their Broken Plate, and it really does show that healthy foods are more expensive per calorie than unhealthy foods, which again really does make them the obvious choice if you're living on a low income. And here you can see just how much higher fruit and vegetables are compared to staples, but also the red line, which are the foods that are high in fat, salt and sugar, or the ultra processed foods. I also wanted to just show this graph, which really exemplifies that low-income families spend proportionally much more of their household income on food than more affluent families. And really this is been a considerable concern for families during the cost of living crisis. And this graph here very nicely shows just the rapid increase in prices since October 2021 on food, and how the energy prices have had to compete with that. But now energy prices dropped a bit over the summer, but food prices have continued to grow in the UK. And it's really interesting because inflation in food has started to slow, but actually because of the time lags in reduced production costs across the supply chain, it's expected that food prices in reality terms will continue to increase for a little while longer. And really this all means that the financial pressures on families living on a low income just won't ease up, which is why we're seeing such high levels of food insecurity in the UK. So moving on to the second pathway. The second one really describes poor quality housing and poor quality cooking facilities. And really these cause practical barriers to storing, preparing and cooking foods. These examples are really quite stark. So one mum talks about how she's got such little storage space for food that she has to go shopping nearly every day. And because her family's so big, she can't buy everything in one day. So because she's got no place to store everything, so she's constantly going to the store. Another mum spoke about how her cooking equipment was completely unreliable, how it would often the cooker would just turn off midway cooking, and so she couldn't rely on that as a reliable source of cooking good quality food or fresh food for her families, and how stressful that was that the power could turn off. And then at the bottom, really, one of the mums talked about the poorer housing causing risks to broader health issues, and that these are multiple compounding factors that families are facing. And this poor mum was talking about how there was a leak in the bathroom and the radiator wasn't working in a child's bedroom, and she needed to come and spend the night with her for weeks on end, and the local council weren't coming to fix the radiator or the leak in the bathroom. And then there was asbestos in the kitchen that also wasn't being sorted out. And these are just compounding factors that cause a lot of stress in individuals' lives, that make the cooking of fresh produce and having a good, healthy quality food, high quality food, very, very out of reach for many families. The third pathway really talks about life's pressures and how uncertainties in life and a constant change of context always makes menu planning and meal preparation very challenging. Many families described how they had to deal with unpredictable incomes. Shift patterns made incomes uncertain, and they never really knew how many shifts they'd get or how much money was going to come in. There was uncertainty about who would need feeding in the house, who would be at the house that would need a meal, and also about having lower levels of autonomy over work and life commitments, and at how this is such a stark difference to higher income individuals who can often work from home and have greater flexibility around food acquisition, cooking, preparing meals. And really, all of this means that there's less time available to plan, shop and cook and clean up after meals. You see one mum, the first quote here, the mum says, you know, that it all adds on the stress factor for my head, and there's this cognitive overload that just makes food right at the bottom of the agenda. It's a necessity, but you want to make sure that it's going to be food that the children are going to consume and eat, that won't be wasted, and that actually it's something quick and easy to prepare. The other really area was around shopping strategies that were used by many families that live on low incomes, and actually that takes a very big cognitive load. Making choices with constrained budget takes time and mental energy. So the quote, or the father here at the bottom, says you have to work out everything. You don't buy the thing you see in front of you. You have to check and, oh, okay, here they have an offer, here this is cheaper, here you buy 3, oh, okay, you get some discount. It's all the time. You have to think in the budget, in a budgeting way all the time. And many families talk about taking a calculator to the store with them, and how that sense of budgeting is very cognitive overloading for many families. The fourth pathway is really describing and highlighting healthy foods rarely meet social and emotional needs of families. And this is a really important pathway to consider when developing food policies. Is that often we sort of take for granted that social and emotional needs are being met in more affluent families. But for families on restricted budgets, they often have fewer leisure time options, such as swimming lessons or going to the cinema, taking their children to soft play or to theme parks, which really does make cheap, unhealthy food an obvious choice of having fun for the family. And it can be a really fun social occasion where actually it makes everyone happy. And I love the quote here, at the bottom, that food makes us happy. When we go to McDonald's, they enjoy it, but most of the time I don't have the money. I will do crisps and some pastries, and then we go to the park with water. We sit down and we enjoy ourselves, and then we go home. But it really shows that fast food outlet actually has a real sense of fun and togetherness as a family, and it really does help to fill that social and emotional need. And one mum at the top here just really described how it wasn't fair that her children were missing out on extracurricular activities or missing out on being able to do fun things. And the way that she could fill that gap was through providing foods that they enjoyed and taking them out to have unhealthy foods. The final and fifth pathway is really around families overwhelmingly talked about how vegetables and healthy foods have to compete with the widespread availability and appeal of unhealthy food. And many families have asked why there are not more promotions on healthy foods, why they're not placed in several places in the supermarket or a store in the same way that you would see sweets, crisps, biscuits placed in multiple locations across the store, priced very cheaply and often on promotion, such as bog-offs, buy one, get one free. They also talked a lot about the local area and having so many takeaways, and that there were very few places that offered healthier options as a takeaway, or even just healthier retail outlets. So there's some great quotes here about there's always buy one, get one free, isn't there, on a packet of chicken nuggets. Also how that the sweets are often positioned to tempt children, and how frustrating that is when you take children to the supermarkets and you have to take them to the supermarkets because you don't have the same levels of social support that other families might have. And as I said, how there's just a ubiquitous and numbers of unhealthy takeaways. And really some of those factors have been supported by, again, quantitative evidence. So one of our earlier studies really showed that actually unhealthy environments, so here it talks about supermarkets, really do exacerbate the inequalities. So you can see here that this is families with lower levels of education, and actually this is the least healthy environment versus the most healthy environment. And here you can see that dietary quality is much poorer amongst families that are exposed to that less healthy environment, where you're not seeing the same trend at all amongst families with degrees because they've got those additional social and financial resources. And we see the same trends for takeaway outlets and access to health outlets in local home neighbourhoods. So really collectively, these findings show that the logical, affordable and appropriate food options for many families on low incomes are the most unhealthy ones. And really, this is why low income is leading to such an unhealthy diet for many families. And really, this is about saying that actually the danger here is that the result of these 5 pathways will lead to an intergenerational cycle of diet and health inequalities. And we're already seeing this, that this constant exposure to these unhealthy environments, be them the social context, the physical environment, the financial environment, this means that children who are born into lower income families are on this high risk, high trajectory pathway where they're over their lifetime are at increasing risk of poor diet, poor weight status, and then less health. And that then means that when they have their own children, that ticks back and actually goes at a higher risk again. So we're seeing this intergenerational cycle. So really there's a need for structural food policies to address these underlying causes. And in the UK, we're starting to see a shift away from, a movement, not necessarily away from, but in addition to more individually focused labelling, social marketing campaigns and Eat Well Guide, really to some more structural legislation like the sugar drinks levy. We've got restrictions on where unhealthy foods are being placed in retail outlets, and financial support through the Healthy Start scheme for low-income families. But really what we need to be moving towards is coherent policies, food policies that start to address many of these underlying factors across the food system. I just wanted to end to say thank you for listening, and thanks to all of our participants and my colleagues who have contributed to this work and to our funders, and just to express that these are our researcher views and not the views of our funders. And then finally, just to say that our MSc program in food policy, many of our students through their dissertations undertake qualitative research as part of their dissertation topics, and how much they enjoy that. So please do, if you're interested in signing up for our MSc in food policy and contributing to this large body of work, we'd be delighted for you to join us. So thank you very much. I just wanted to leave you with a final quote by Ha-Joon Chang, which just talks about equality of opportunity not being enough, and how we really need to do more to build a genuinely efficient and a fair and effective society. Thanks very much.
Thank you so much for such a wonderful presentation, Christina. That was absolutely fascinating. I can't see any burning questions in the Q&A at the moment, but please remember everyone who's attending to pop those through, and we will have Q&A time at the end. So I will now hand over to the lovely Rebecca to present her work. Over to you, Beck.
Can you see my slides and hear me okay, Georgia? Yeah, great. Thank you so much. Good morning from Australia. And thank you, Christina, for that fantastic presentation. I was nodding along, and it's so wonderful that you've been able to sort of set a bit of the context and rationale for why food insecurity and working on nutrition inequities is so important. And I was hoping that you'd do that so I can just sort of skip over a little bit of that background and key definitions and get straight into telling you about some of the studies that I've had the privilege of working on over the last few years with this wonderful team of researchers on my entry slide. So there we go. I'm going to tell you about 4 or 5 studies that have been conducted as part of a collaboration between US and Australian researchers at IPAN and the Gretchen Swanson Centre for Nutrition, and then close off with, I guess, some considerations or remaining research gaps or areas of interest I have in this space, and make sure that we leave time for a Q&A. I am largely a qualitative researcher, so I did want to acknowledge my positionality in this work too. I'm a cis woman. I am a mum to a toddler, and I also have Anglo-Celtic background. I'm an English speaker, and with that settler colonial background as well. And in terms of a learning curve, I was thinking about my research in this particular population, which is really about families with children under the age of 6 and also that pregnancy phase as well. And if that research were a human, I would say that I'm kind of at the toddler phase, the messy toddler phase with this particular research. So whilst I've worked in food security for many, many years, this is a new population group for me. And I do really respect and acknowledge that there's a big evidence base and massive global agendas around the first 2,000 days and the importance of food and nutrition in those early stages of life, and I'm still kind of learning about it, and many of you in this SIG no doubt have substantial expertise in it too. So in 2019, I was so delighted. It was a real career highlight for me to have connected with Amy Yarrow and her team at the Gretchen Swanson Centre. And they had quite a broad remit initially in forming a collaboration that really was about a spirit of shared learning and disseminating what works to address food insecurity. And we had some funding that enabled us to, achieve that vision. And also we sort of iteratively decided, well, what we would focus on through our collaboration to reach that goal. And ultimately, we initially were interested in household food security and households with adults and children. And then we sort of refined that further to, as I said, look at the first sort of 2,000 days in particular, and just some stats there about the US and Australian context and the prevalence of food security in both regions. So just quickly, and I'll step you through these a little bit more. We had several phases to this project, initially sort of setting up a compare and contrast of both countries, then deep diving a little bit more into the literature around high income countries and this life stage. Then we were able to spend some time in doing some qualitative work in both countries over the pandemic. And then we decided to really kind of focus on devising a new household food security measure and doing some cognitive interviews and finally piloting the survey. So from that first critical public health commentary, we were able to publish that paper, and you can look up most of this work, or I can make it available after this webinar too. What we did was ultimately publish it as an opinion piece, but back of house, what that actually looked like was sharing key pieces of literature, key policy documents, and having multiple discussions between the US and the Australian group about what's going on in the food security space in both countries, particularly what's relevant to the household level food security in terms of measuring it, in terms of policy and program responses, in terms of the evidence base about understanding who's being impacted and what some of those driving forces are. And this slide's a little dense, but I'll direct your attention at least to the similarities. So in both contexts, and this is probably fairly comparable to the UK context you've just heard about, one thing that's a given, I guess, that isn't here is that both in the US and Australia, we are massive food producers. We have an adequate amount of food, including a lot of good nutritious food that is locally produced. So it's not that there's not enough food in both of our countries. Income is a key key risk factor. It's a key discriminant or a key driver of food security status. So if you're on a higher income, you're much more likely to obtain food security versus a low income. Also, geography in our very big countries can be a barrier, both from a regional and remote perspective and getting food to where people live, but also from a food swamps and food deserts perspective. So over availability of non-nutritious foods or inadequate access to healthy, culturally appropriate food through mainstream retail outlets. We also have a large not-for-profit food assistance sector in both countries that really helps to sort of fill the gaps in what might otherwise have been provided by governments. And measures of household food security could be improved in both countries, and hence why that became quite a strong thematic in the work that we're doing. In terms of the differences, I won't elaborate too much, but a big difference probably is that in the US, there are 15 federally funded food aid programs, including their massive Women, Infant and Children program. So they really do have a strong food security focus in that age group, unlike Australia, where there's really a dearth of policy interest, particularly in this population group, unfortunately. So after that first setting the scene study, we decided, as I said, to sort of deep dive a little bit more and do a rapid scoping review to sort of set up the rest of our studies, reviewed in duplicate with no quality appraisal. And really the main kind of inclusion criteria was, if a study was relevant to our aim, we were able to draw from it, including qualitative and quantitative studies. And what we learned from that scoping review and from the 29 studies we ultimately included, and this is also a published study, you can see it on my screen right there, is that there are, we sort of distilled in a narrative synthesis way, or we really extracted content rather than some sort of quantitative approach to this particular review. This is not a meta-analysis or anything, but rather we were trying to understand what are the important factors that contribute to food security in this particular group of population, or said another way, what are the constructs of food insecurity that are relevant to pregnant women and caregivers of young children? And we distilled these 13 themes, or these 13 constructs. So I'll talk you through some of them with some a little bit more examples, but yeah, in the paper we go into a lot more detail. So of those 29 studies, at least 13 of the papers really did emphasize that income and employment is a really important sort of factor contributing to food security in this population. So for example, if you're on a low income or lost a job or relying on income support or welfare and benefits, that was inversely associated with food security. And then same goes other things that were inversely associated or less likely that people were food secure were things like when there was a presence of maternal depression or poor health status. Down there at number 4, housing and energy insecurity, receiving a housing subsidy or living in crowded houses. And also if caregivers or mothers had lower levels of education. So we're actually probably picking up quite a lot of the themes that you've just heard from Christina as well. Just that number 2 there, in terms of coping strategies, there's a little bit more nuance in the evidence about this. So sometimes buying cheaper food or shopping at value stores, using coupons, these were seen as ways of adapting and coping and actually still being able to maintain food security. But if they were used regularly or for a long period of time or in more sort of extreme ways, they could contribute to food insecurity in households as well. So they're the top sort of 5 constructs we learnt from that evidence base. And I won't go through the others, but they, they're less present, I guess, in the evidence or in the studies as you kind of go down the numbers. But nonetheless, I suppose for me, the big takeaway from this was there is a lot going on for households with young children that could possibly be leverage points to intervene in order to support food security, but also there's particular consequences or drivers of food insecurity at this life stage which are particular to this life stage. So things like maternal health, mental health, and depression, or healthcare for this particular life phase, or parents' acculturation. And as I said, as a sort of a new researcher to this population group, I've had to think about instead of working on sort of population-wide food security, there are particular things that we need to be cognizant of in researching or designing programs and policy to respond to this age group and to support their food security status. After that scoping literature review, we went about undertaking some fairly broad, they were semi-structured interviews, both in the US and the Australian settings. So we sort of sampled locally, and we were interested to talk to caregivers of children under 6 or pregnant women. And we used that scoping literature review to help set up our semi-structured interview guide. And it was occurring over the global pandemic. So of course that featured quite a lot in what people were describing as their lived experience at the time. And as you might expect, these interviews were recorded verbatim, and we in each country had our data sources. We used NVivo, and we undertook a thematic analysis in a joined up way, but ultimately on our own sort of data sets, and then combined them. And for the purposes of this presentation, I'm going to talk you through about what we distilled from those interviews, particularly to devise a new comprehensive household food security measure. But before I do that, just flagging who was in our sample. We had a little bit more participants from Australia. A fairly small amount of women were pregnant, so 5 in the US, 7 in Australia. Most of them had more than one child. So whilst we were quite interested in their child that was younger and under 6, or their their child that was on the way if they were pregnant, many of them also talked about, what else is happening in the family and their children's needs more broadly. And 76% of them were food insecure, and about just over half of them were single or separated women. So as I said, we really took at least part of our analysis from those interviews was really about setting up a new household food security survey, because we thought that would be an important contribution to the evidence base in both of our countries, so that we can better design programs and policies to respond to the food security needs of this particular population. I won't talk through all 13 of those constructs again, but what we did with our analysis was we mapped what we took from those interviews against the known constructs that we already have. And what we wanted was, what have we learned additionally, or what is some nuance that we hadn't otherwise covered off from the quantitative and qualitative studies we'd included in our scoping review. So again, perhaps some of those themes and ideas there you've already heard from Christina's wonderful presentation, and as I said, COVID was also and the lockdown measures of the pandemic were quite front of mind for our participants too. And so what this enabled us to do was ultimately synthesize the components of household food insecurity into 3 main areas. We felt that there were really important sociodemographics and risk factors of food insecurity that should be captured in a comprehensive measure of food security status in a household. So we grouped all of those together and went out and found key questions that related to that would provide data and insight on those risk factors up the top, that first group. The second group, we use the Food and Agriculture Organisation's dimensions of food security to help get at really that experiential component of household food security, and design some questions around utilisation, access and stability that didn't currently exist at the time, although there's some wonderful work in this area more recently, and we also and availability, and we also embedded within that some kind of current measures, including the USDA household food security tool. And finally, we also wanted to get some data and insights from households about outcomes or consequences of food insecurity in terms of health and diet quality. So what we're hoping is we're getting more of a picture of the puzzle, and late last year we were able to go and collect data through a self-administered survey with 78 questions in low-income households that had children of this age range, and we got a little extra funding which enabled us to include New Zealand in this pilot, and we're currently analysing this data, and I'm hoping to be able to share it at the ISBNPA conference in Omaha of next year, so stay tuned for that. So just moving on now, I just wanted to flag that we do have some other papers, but everything else I've otherwise presented so far is already published. So do let me know if you're interested, or you can find my profile on Deakin. So what have I learned about, working in this really important life stage? I thought I'd share a few insights before I conclude. So in my opinion, and particularly from the Australian perspective, and in no particular order, I really think infant formula and the public policy approach that we currently take, I'm wondering if we've got it right. It's really costly in Australia. You can't get it through emergency food assistance. So I think that merits some more attention. And I'm also really interested, and I wish we had have asked in our survey about breastfeeding initiation and maintenance. And in future iterations of our survey, I think we should ask those types of questions. I think childcare and early years education could be a really important setting, and it's not a setting that I'm currently aware of that's right up front in our thinking about how to address food insecurity in Australia. We're talking about schools, we talk about emergency food assistance. There's some progress on more sort of policy and community level responses, but I think we really don't look at this age range enough, and I think childcare settings could be potentially really important. I'm really interested in family violence and its relationship with food security, and I'd like to do more there, and we do ask a single question about that in our survey, so I'm looking forward to seeing that data. Not really looking forward to it, but you understand. I think it's important that we investigate this and understand it. And I too am interested in the intergenerational impacts of food insecurity, like Christina had flagged. And I think smoking and food security is another kind of underdone area. And I think we could be thinking about how we perhaps tackle these things together. Also, smoking costs a lot in the Australian context because we have wonderful tobacco control measures, but it does mean for those households where that addiction is present, they're spending quite a lot on smoking, and perhaps at the cost of good quality food. And in terms of program and policy gaps, I'm delighted to have 2 forthcoming PhD students starting in this space next year with some wonderful colleagues here at Deakin, really looking at services, policies and health professionals here. And as flagged in my little bio, I am working on a big global review. It's taken a couple of years, and it should come out in the next year or two, which has been so wonderful to really look at social and economic determinants and drivers at a population level for their capacity to address household food security. And I will do subpopulation analysis with that intervention data set, and I will be looking at what might work or what's known to work for this particular age group as well. So just before I finish and hand over to Georgia, I wanted to flag a couple of my favourite papers and thinkers in this space for those that are perhaps thinking about working on health inequities maybe for the first time. Stephanie Nixon's work is wonderful on critical allyship. Leslie Frank, the sociologist, and Mariana Chilton, the public health professional, they have worked for many, many years in this particular population group and on food insecurity. And I've learned so much from these two in particular, so I strongly recommend them to you. And of course, I also worked with absolute heroes on this screen as well. The Gretchen Swanson team do wonderful work on federally funded nutrition assistance and food security program at such a huge scale in the US. They're great. And that team in the middle there, Paige, Fiona and Julia, are working on pregnancy and food insecurity too. And big props to my wonderful mentor and director, Sarah McNaughton, as well, for all of her help. So thanks so much, Georgia. Look forward to a chat soon.
Wonderful. Thank you so much for that, Beck. And yeah, what a fascinating presentation and study. I know I have loads of questions for both you and Christina, but I'll open up to the floor first and see if anybody else has any questions they want to ask. Please pop them in the Q&A or pop your hand up. I'll give you a moment, otherwise I will start with my questions as moderator. I can be greedy. Well, while we're waiting, I am going to start us off then. So I guess something that I found really interesting, Christina, in your presentation was that kind of peak in those obesity inequalities over the COVID-19 period. Do you have any thoughts or insights as to why that might have been the case?
Yeah, I think food insecurity is a major reason for that, but also the context in which families were living. So many more affluent families had greater flexibility with working and were able to do sort of more physical activity, had better access to nutritious food, and were able to spend more time together actually cooking as a family. Where another study that we've done has really shown that actually there's a big difference in the ability for lower income families that just wasn't there for them. So it was much more stressful. There really were financial shortages. There was much more reliance on emergency food. Families were cramped in small spaces, in small houses, and that you really did. So snacking became a really common thing amongst lower income families. And while snacking was prevalent in higher income families, actually it was often buffered by the ability to undertake physical activity or have more recreational opportunities as a family in sort of greener outdoor space, where it just wasn't the same scope wasn't available for lower income families.
That's really interesting. And do you think that that kind of is going to have ongoing repercussions as a result from that kind of snapshot period?
Yeah, it's interesting because there's been a bit of a bounce back. Obviously, that you showed a bit of a peak, and then it bounced back a little bit, and it shows the importance of the school setting and getting children in together and having school food standards for free school meals, and all children under sort of kindergarten 1 and 2 in the UK have free school meals that are all abide by a certain school standard. So I think that those contextual factors and the ability that there is good service provision of some sorts of food actually did show a bit of a recovery. I think the danger is that the current cost of living crisis really sees the scope for that to be exacerbated again, particularly with that crisis going on for quite a long period of time. So there is a real fear that actually that will have quite negative impacts on health and health inequalities, particularly around diet, because food has been so badly affected with the rising cost of the price of food and the availability. We've had quite supply interruptions in the UK around fresh vegetables for climatic reasons, for the cost of living crisis living for fuel and energy, and obviously fertilizers from the Ukraine war. So there's been a number of what's called the perma crisis that is really having quite a negative impact on food prices as well as food availability for some families.
Oh goodness, very interesting. Not positive though, is it? Something we need to know. All right, we've got some questions coming through. Thank you very much. So the first is from Celeste. So she is asking a question for you, Rebecca. She wants to know what you have planned for adapting the tool you will create to different countries, contexts and environments, notably with regards to cultural aspects, accessibility to food, etc.
Thanks for your question. When we were able to get some funding to invite a New Zealand collaborator onto the project, or I should say we had enough funding to enable our data collection in New Zealand, we decided it was important to have a co-investigator from New Zealand so that they could ensure that we did some of that cultural relevance and slight changing and reframing of the survey for that context. We don't have any definitive plans as yet. It will be resource dependent, sort of our kind of next stage, but that's really vital, I think. And so, you're getting a data set, for example, that can be comparable to local countries and framed in a way that local participants sort of, understand. And I think we need to do some work as well on, testing the appropriateness of the questions as well. We could do some more cognitive interviews, and working on things like the validity of our measures, etc. So it's very much in prototype phase, but I would love a PhD or a postdoc to come and make it their own. Because I still really believe in the value of that particular comprehensive household food security measure. And I think it could work for other age groups as well, even though we've designed, questions to be quite specific to that life stage. There are some general questions as well that would work well for other age groups because I guess, monitoring of food insecurity isn't done terribly well in many countries, and probably the US is probably that best standard of a national, regular, ongoing measure conducted, by statisticians and with that big data set. So it's great to have learned from the US on that front.
Wonderful, thank you, Beck. And kind of following on from that, we have a question from Jeffrey to both yourself and to Christina as well. Great presentations. Wondering if any of the works look more into the cultural diversity or ethnicity of families and how food insecurity status may be different for these cultural groups, particularly when both countries have a huge cultural and ethnic diversity. So I'm not sure which of you wants to tackle that first.
I'm happy to say something initially, and then Becca, feel free to come in afterwards. I think this is a really great question, and one of our studies, well, we've got 2 studies at the moment ongoing in London, in sort of different boroughs in London, and one has done a lot of work to show that families with no recourse for public funds, so they come in asylum status or refugee status, but haven't actually been awarded proper sort of status for residency, actually they are often very, very, very challenging situations because of the complexity of language barriers and different cultures and accessing the right types of food and foods that families want, in addition to having very poor housing conditions often. So make that really very complex for very vulnerable families. And I guess it's about linking them up with the right services as much as possible, and also showing some sort of advocacy for them in some way, sharing that back to local authorities. So that's sort of our responsibility as researchers to highlight some of that work. One of the things that we have done with less extreme cultural situations is we've done some participatory work that is actually just coming to an end at the moment, and it's been a fantastic participatory policy making. So working with 10 different families who have been living with low income, particularly through the cost of living crisis. And it's been a period of using the photo voice activity. So some of my colleagues have been leading these workshops, and really through that process of monitoring and group reflection have really allowed families to sort of come to really highlight and feel grips over the external social and environmental determinants that are really driving their food choices and how unfair that feels. And then there's been a participatory workshop with policymakers, particularly in the local council policymakers, and the families have really presented and worked with policymakers to develop sort of a list of 10 different policy recommendations that can be actioned locally to really make a difference. So it's actually been a really lovely journey to see, and much of that has cultural relevance. And I think there's much more that we could do in that space around participatory policy making to really build empowerment's not the right word, but actually action on many of these issues that have been raised through lived experience research.
I guess I'd perhaps sort of reiterate my last answer to that question, that, should this survey be in a phase where we can design it for culturally and linguistically diverse communities, I would only do that in partnership with researchers or community representatives from those called communities, or that's the acronym we use often in Australia, same goes, throughout, I guess, any research project in that setting that I've worked on to date. So hopefully that's helpful.
Perfect. Thank you.
And of
both.
course, it's important. Of course, it's vital. It's vital because, the drivers for food insecurity are nuanced to the local setting, to a family's cultural identity, their economic status, their employment status, household size, all sorts of things. There's far from a one size fits all, and equally, I think maybe there can be some assumptions made that culturally and linguistically diverse communities are always at increased risk of food insecurity, but that hasn't been my experience. And the culture of food growing, food sharing, supporting one another through adverse circumstances, that they're all real strengths and resilience to those larger economic forces or food shortages that we've all kind of been experiencing over the last few years.
Wonderful, thank you. That really just does highlight how important it is to make sure that every tool that we use or every time we do this exploration really is well-rounded, and we consider all of those factors as well. We have a couple more questions, which is great. We've got a few minutes left. So one of them has disappeared. So the intersection of housing and food insecurity came up in both presentations. How can we as public health nutritionists advocate for better housing conditions and raise the importance of food considerations with policy and practice partners providing housing? That was from Kaya. Thank you, Kaya. Don't know if either of you want to tackle that one.
I can jump in first and say that it can be uncomfortable being a nutritionist that starting to work on social determinants of health and be interested in housing policy or welfare and social protection policies. And I guess I found myself in that somewhat uncomfortable space quite a lot over the last few years, because I really do believe that food insecurity is not only a food problem, it's really a social and economic problem. And so, that firstly, I empathise and can appreciate that sometimes in our busy schedules or research remit, it can feel hard to kind of work in these other areas. But I think we can do that in collaboration, or certainly there is a good evidence base about, how important it is to have running water and adequate food storage and safe places to store food, as well as, access food locally. So just having those conversations and bringing that into your wheelhouse to say that if we are motivated to address food insecurity, we have to work on these issues. Otherwise, we will get nowhere. And, my Cochrane review will include the evidence base about housing initiatives and the extent to which housing, and I sort of use that as a broad term, so there should be a range of different policy types under that umbrella, the extent to which housing initiatives can affect household food security status.
I think I'd just jump in to talk about policy coherence, and actually that joined up policy making is one of the key aspirations that I think we could all be aiming for, and that is our role as public health nutritionists. And sometimes it won't be talking the language that we're used to talking about. We might not be talking about diet and health. We might be talking about inequalities and equal access and, the right conditions for housing. So I think it's okay for us to think more broadly about the terms that we use to make sure that we have aligned agendas. And I completely agree with Rebecca that actually in many ways that is our responsibility, and that we are able to have that bigger picture as public health and public health nutritionists, and therefore should absolutely be part of our roles. And it's a real opportunity.
Beautiful. Thank you for those responses. I have a question from Andrea. So she said, great presentations to you both. From your collective expertise, what perspectives do families facing food insecurity have regarding obesity prevention policies like the soft drink levy and restrictions on BOGOF deals, considering their potential impact on the cost of certain foods?
I'm happy to jump in here. So the BOGOFs are the buy one, get one free, and the soft drink levy. From the families we've spoken to, prices fundamentally felt like an unjust driver of choice. That, there's this huge difference between the cost of healthy and unhealthy food, and that really does feel like it needs to be addressed. So I think, again, any food policies that we could introduce that start to improve that inequity between the cost of healthy and unhealthy foods, families are very, very supportive of. Of course, that's not necessarily always universal, but largely, particularly when it comes to children, families are that they just, pester power is real, the cost of food is real, the advertising impact is real. And I think that families are starting to really say, actually, we want to address some of these unjust factors, that it is not equal, and that actually our decisions are being defined by the environments in which we're living.
All right, I reckon we have one final question, and this one is for you, Beck. So Ilana is wondering whether anything came out in your interviews with mothers around concerns of food insecurity on children's health, or whether it seemed that they were trying to protect their children from the burden, as some other qualitative literature has shown.
Thanks, Ilana. I think it mostly was the latter, that their interpretation, mothers and caregivers in our interview, some of them were grandmothers, was that they were doing enough, and they were going above and beyond to keep from their children, particularly their younger children, their economic circumstances, or that mum or grandma would eat later, perhaps even if at all, but as the kids got older, they seemed to describe being willing to sort of share a little bit more of the reality with their children. And I suppose we found it quite interesting, because by a little bit older, I think some of our interviewees were talking about sort of 6 and 7 year olds. And of course that could be child by child as well. Some certainly describe their children as kind of off in their own world and not really aware. I don't know objectively what was happening for the children. Ultimately we had the caregivers as the whole representative for their household, and there is some evidence to say that despite caregivers describing this, actually there are food insecurity impacts perceptible, or nutrition impacts playing out for children that perhaps caregivers aren't entirely aware of. But yes, from this data set, we saw some, or we heard some pretty extraordinary things that caregivers do, of course, to take care of their special people.
Well, thank you both so much for your absolutely amazing presentations. This is such an important issue, and you're both doing amazing work in this space, and it's a privilege to listen to you both present your work and to answer questions. And thank you everybody for tuning in to our webinar today. That's it. We will put this recording up on the website, and it will be sent around in a couple of days. But other than that, I think we're good to sign off. So thanks everyone.
Thank you.
Thank you.